All right, well, great. Thank you for joining us again online and in person. We're going to get rolling in the interest of time. I'm going to give a very brief presentation about something exciting that is going on in our program right now. Remember I told you when I began this whole spiel that there is a connection between the laboratory research that is done in our program and what we are doing in clinic. What we learn at the laboratory bench impacts what we do in our clinical practice. That's what I'm going to tell you about today in very brief fashion. Okay. So the first thing, Dr. Scharfman alluded to this, the first thing that we learned way back in the day was that there are these little, let's call them inhibitors on immune cells. So the immune cell in this picture is that angry looking dog. That angry looking dog is an immune cell in your body, and it wants nothing more than to go and attack a cancer cell that is developing. But you will notice that the dog is restrained by a chain that's got him chained to the ground. Everybody see that? So the therapies that we use cut that chain. It releases the hounds. It allows the dog to go and attack the cancer cells. So I'm going to tell you a little bit about the way we're using that. The context here is basal cell carcinoma. Basal cell carcinoma, or BCC, believe it or not, is the most common human cancer. Around the world, most common human cancer. Sometimes this cancer gets way out of control to the point where we need medicines like the ones I'm talking about right here, the ones that cut the chain, to help patients battle back those cancers. Several years ago, some investigators took one of those medicines that I'm talking about, those anti-PD-1 chain cutter medicines that I'm talking about, and they tested it in a big group of people who had these horrible basal cell carcinomas. And the way that they tested it was what is called the second line, which means that patients had already been given another kind of medication first, and then they came in and they got those chain cutter drugs that I'm talking about. And what they saw in that trial, in the second line, what they saw in that trial was that between 20 and 30% of people were having a response. The tumors were shrinking in about 20 to 30% of people. So 20 to 30%, you'll say, that's not bad. That's almost a third of patients. However, in the rest of the skin cancer world, that number is way too low. In melanoma, we're seeing 40 to 50% of people whose tumors shrink with the chain cutter medicines. And in squamous cell, it's even higher than that, 45 to 50. And then there's this other skin cancer called Merkel cell, which is awfully rare, but it too responds to the chain cutter medicines 50 to 60% of the time. So why should basal cell be responding at half of that rate? We asked the same question, why should the number be so low? And perhaps it's because the way that they used it was the second medicine people received. Those patients in the big trial I was talking about already got one other kind of medicine, and then they got the chain cutter medicine. Maybe that's why. So as a result, we at Hopkins started a clinical trial several years ago using the chain cutter medicine, but not in the second line. Now we're using it in the front line. And the idea is, could we get those response rates back up where they need to be, around 50%? Here's a guy who's on our trial. He's 58 years old. He has this terrible basal cell cancer on the back of his shoulder on the right side. It was 7 centimeters across when he came to us. We started him on the chain cutter medicine that's called Nivo, by the way, N-I-V-O. Nivo is the chain cutting medicine. We started him on Nivo, and 3.5 months in, he comes in, and his tumor, you can see, is already beginning to get smaller, right? We're making progress in a good way. So he gets his year of therapy. That's just how we wrote the study. He gets his year of therapy, and he comes in again and again and again and again. And 27 months later, we see him for another photograph, and that tumor appears to be gone, right? So we're making progress. He's 27 months, and it's not stopped responding. It's ongoing. His response is ongoing. How long is this response going to last? I don't know. We shall see. That's part of the excitement of a trial, is maybe we give this guy a really, really durable response, years and years and years, perhaps. This is interesting. If you took a little piece of tumor and you looked under the microscope at the beginning of when these guys started to see all these purple cells, this is a microscopic photograph of all the tumor cells, all that purple is cancer, right? Before therapy is on the left. Look at the 2 weeks into therapy. We took another biopsy of his tumor 2 weeks after he had started therapy. All those green and white and orange dots, all of those little tiny things are angry immune cells because we had given this guy the chain cutter medicine and that angry looking cartoon dog that you saw a bit ago. Those angry immune cells are destroying those purple tumor cells. So in our clinical trial, we've got about 30 patients on the books at the moment. About 50% of those patients have responded, which means that our hypothesis was maybe correct, that if you use the chain cutter medicine in the front line, not the second line, maybe you're getting the higher response rates that we were looking for. But you'll say, well, the 50% that you're helping, that's great, but what about the 50% that you are not helping? The other half of people that need help. So remember I told you that we go between bench and bedside. The laboratory stuff that we learn informs the way that we treat clinically. Well, some of our counterparts looked at basal cell carcinomas under the microscope, and they said, you know what, there is another something that is holding back the dog. In addition to that chain that I showed you that had him chained to the ground, there's also a muzzle on your immune cell's face. They can't open his mouth. There is something else that is preventing your immune cells from attacking cancer. So we said, that's interesting. We have a medicine that can remove that muzzle. So we're going to give the chain cutter medicine and we're going to give the muzzle remover medicine both at the same time and see if that works in the patients where just the chain cutter didn't work. Here's this guy who came in with a big basal cell on near his eye. The first stop actually for him was a surgeon. He went to a surgeon and said, I've got this big tumor in my eye. And the surgeon said, well, I can cut that out, but your eye is going to come with it. And the patient said, I'm not up for that. I would like to pursue some other line of therapy. So he came and joined our trial, 64 years old. So he started with the 17 millimeter tumor next to his eye. We gave him the chain cutter medicine, and that tumor did nothing but grow, just got bigger and bigger and bigger. And at this point, he's gotten just the chain cutter. It's now 22 millimeters across. It's beginning to make it so he can't see out of that eye. It's growing across his eyeball. And so we said, all right, we're going to give you the chain cutter medicine, and we are going to add the muzzle remover medicine, and we'll see if that works. So we did. And I tell you, it was like flipping a light switch. Here he is at 10 months, and that tumor is gone. It was quite amazing. At his first evaluation, after getting both of the drugs, he came in, and already you could see that the tumor was beginning to regress. And now we really can't see it. That's why we drew a circle instead of a little caliper there. All right, that's it for me. I just wanted to tell you an example of one of the ways that we are coordinating with our laboratory colleagues to understand the science behind the way cancer grows and how that informs what we do clinically to treat patients just like this.